Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
There was a lot of emotions actually getting to that point with most insurance companies, getting the approvals, filling out the forms. I was very lucky with this particular biologic. The company behind them, they have an amazing care team that reached out and was able to help me with that. So a lot of mixed emotions. We had all the hope that this treatment would be the right one. There was happiness, relief, anticipation, a little bit of anxiety as well. What if this doesn't work the way that we expect it to? What's going to be the plan? But you kind of take that one day at a time.
Seeking the optimal treatment for psoriatic arthritis can be filled with uncertainty, decisions, and glimmers of hope. If you or a loved one is dealing with psoriatic arthritis, these mixed emotions may be all too recognizable. Have you fretted over trying new treatments? Had fears over safety, side effects, or the thought of transitioning from a pill to an injection? In our second episode, we continue to explore these questions with members of the psoriatic arthritis community, delving deeper into their treatment experiences and collaboration with healthcare providers. We uncover the courage, confusion, and determination that define the pursuit of a treatment that manages your symptoms and enhances your overall well-being.
Hi, I'm John Arora. I am 38 years old. I've been living with psoriasis and psoriatic arthritis. I've been diagnosed since I was 13 years old. I am in the Toronto area in Canada. I am a huge basketball fan. I love to cook, and I very much enjoy my career in cybersecurity.
Hi, I'm Angela DeGrassi. I'm the host of the Psoriatic Arthritis Club, a podcast from CreakyJoints and the Global Healthy Living Foundation, where we explore the ups and downs of managing and treating PSA, which for the uninitiated is an abbreviation for psoriatic arthritis. We'll be sharing insights from patients and a leading rheumatologist. All right, John, let's dive in. Thanks for taking the time to talk with me today. How are you?
I'm good, Angela. Thank you. Thank you very much for having me.
So a little more about John. John, you were diagnosed with psoriasis at the age of 12 and battled skin inflammation at varying degrees of severity. Since then, at some point in your young adult life, over 60% of your body was covered in the dry, scaly, white patches of psoriasis. And then you received that diagnosis of psoriatic arthritis at the age of 32, in addition to psoriasis. I understand you began treatment when you were 34 years old using biologics, which helped the symptoms of psoriasis and psoriatic arthritis stay under control. So, John, I want to open up this conversation by asking what led you to seek a diagnosis. Can you tell us what symptoms you experienced that prompted you to talk to your doctor?
Yeah, absolutely. So I think one of the biggest symptoms was just the management of the scaly skin. At that time, I had been diagnosed with PSA, but none of the symptoms like the joint pain and some of the other more common symptoms had yet to rear its head. So it was more the coverage of scales on my body. And it was in talking with my wife, and it was her mother who also had psoriasis and possibly psoriatic arthritis too. So there was kind of a shared bond between us. Up until that point, I'd been a little hesitant and kind of out of the loop in terms of what treatments were available. So through the encouragement of my wife, we did a lot more research, and credit to her, she found a seminar on psoriasis and psoriatic arthritis that was being hosted in Toronto with one of the leading experts at the time. So when we went, it was a really great experience. So, after that conference, it really opened my eyes in terms of what the latest treatments were. There were patients there that were able to share their stories. So that was also very inspirational to have folks that were fighting the same battle that I am, sharing their treatment stories. And, that really inspired me to say, okay, let's do something about this. Let's see if we can get my quality of life better. I don't have to suffer with this anymore. So that was kind of the catalyst right there, right after that seminar that we attended.
That sounds like it must have been really helpful and really important to get some really good information about treatment. And I know a lot of people have hesitancy to start a new medication. Did attending that conference or seminar help to ease any concerns you had about safety of taking these drugs?
Absolutely. Absolutely. And that was kind of my number one hesitancy prior to going in. I had done some research myself on biologics and certain treatments. And, one of the things that concerned me the most was the possibility of becoming immunocompromised and getting sick all the time. I was very passionate about my career and prided myself on going to work. And, the idea of getting sick all the time really didn't seem that good to me in my mind. That was one of the big things. Also changed, the idea of having to depend on a medication, that changed what that means to my lifestyle and what I can do and how I can do things. So, going to that seminar and having the experts speak, having other patients speak about their experiences, actually doing a deep dive into some of the medications. I learned that not all biologics are the same. So there are different biologics that treat certain types of psoriasis and psoriatic arthritis differently. So it really opened my eyes to a world that it's not one size fits all. And it really allayed a lot of the fears and got me excited about the prospect of beginning treatment and getting help versus kind of the more fear associated with it.
And since you started treatment for that first time, are you still on that same drug, or has there been a time where you've had to change?
Yeah, I did have to make a switch. My first biologic was an oral biologic. So the decision was made with my care professional at the time that, that was kind of the best treatment for me. So the oral biologic worked, I would say, for about 2.5 years. It got me from, I think my body was about 90% or 85 to 90% covered in psoriasis. And I was starting to have symptoms of psoriatic arthritis as well, soreness in the knees, soreness in my joints. So as soon as I started taking that oral biologic, it actually got me down, I would say, to about 30% of my skin was covered, and it took care of the joint pain and soreness. So that was great for about 2.5 years. So right around, I would say, kind of the start of the pandemic in 2020, I was starting to notice a rebound in my skin condition and also psoriatic arthritis, like the more traditional psoriatic arthritis symptoms in terms of soreness in my joints. My hands were getting very sore to the point where it was starting to affect me picking up things, lifting heavy things became cumbersome, soreness in my knees and my joints came back. So after working with my care professionals, and since I moved out of the Greater Toronto area, I actually ended up switching to a new dermatologist. And because my psoriatic arthritis was kicking up, I was referred to a rheumatologist as well. And the decision was made to switch me to an injectable biologic. So I've been on that since, I believe, July of last year, July 2022.
Wow, that sounds like an incredible change when you started that biologic for the first time. We're glad you made the decision to do that. It seems like it must have had a pretty significant impact on your quality of life.
It has been just amazing. And speaking with my dermatologist when I made the change, one of my fears was, okay, I had done the oral biologic for 2.5 years. It worked kind of okay. It worked pretty good in the beginning. And towards the end, I started having a rebound of symptoms. So my concern was, okay, how much runway do I have with my new medication? And luckily, my dermatologist was very hopeful and positive about the change. He did explain that, again, certain drugs work different ways. And my condition had progressed to the point where the oral biologic I was on was really only used to treat mild to moderate psoriatic arthritis and psoriasis, whereas the injectable biologic that I'm on now treats, moderate to severe. And he has multiple patients that have been on the biologic for 5+ years. So it was such a relief to get on a new treatment that took care of the rebound and actually got me down. I would say I'm about 99% of my skin is now clear. And the joint pain has really gone down from where I would say on a scale of 10, from a daily 7 to maybe some 8s and 9s down. If I do have an odd day where there's a bit of pain, it's barely cracking a 1 now. So it's been amazing to get on this new treatment and to have that assurance from my medical team that this is here for the long haul, and I can kind of breathe a sigh of relief.
That's so fantastic. What a great feeling that must be to experience your condition going in a positive direction like that. What was going through your mind on the day that you started your first dose of that new treatment?
There was a lot of emotions actually getting to that point with the, most insurance companies getting the approvals, filling out the forms. I was very lucky with this particular biologic. The company behind them, they have an amazing care team that reached out and was able to help me with that. So a lot of mixed emotions. There was happiness, relief, anticipation, a little bit of anxiety as well. We had all the hope that this treatment would be the right one. But there was also a little bit of anxiety and fear. What if this doesn't work the way that we expect it to? What's going to be the plan? But, you kind of take that one day at a time. So, yeah, I do remember an overwhelming feel of when we went to the clinic that did the injection training, my wife and I, and we went through the process. And when we got back to our car in the parking lot, it was just kind of, wow, we're done. Like I said, a lot of happiness, relief, and a little bit of excitement and anticipation for the future.
Right. Do you still experience flares?
Yes, I do. So one of the things that I think a lot of folks that have PSA and psoriasis and other autoimmune conditions like this. And one of the things I've learned, and a lot of folks on social media, I do follow a bunch of folks online that have chronic illnesses like PSA and certain folks that have PSA. It's been very create a sense of community. It was very comforting to know that other folks that are on similar treatments and have similar conditions, they still get flares. I still do get flares, but that's okay. I'll have a flare every now and again where I'll wake up and my hands are a little sore. I'll feel a little tired and a little bit fatigued. But like I said before, on a scale of 1 to 10, where I was constantly in the 7 to 8 range, luckily with my experience, with my treatment, I'm barely cracking, I would say, a 2 on kind of my worst days with flares. Unfortunately, they do happen, but when they do, I'm kind to myself. I take it a little bit easier, just let myself know that it's okay to relax a little bit, spend a little bit more time in bed, relax a little bit more, and take care of myself when it does happen.
That's great. Yeah, it seems like taking care of yourself and being gentle with expectations is what you need to do when you are in that situation of experiencing a flare. You mentioned an online community. What's it like talking to people about your condition?
I would say really, really rewarding. When I was diagnosed, the internet wasn't what it is today at all. And I had been just living with this alone for a long time. So, kind of engaging with the communities now. I participate in forums where folks will post about psoriasis and psoriatic arthritis. And it's really rewarding to be able to respond with kind words, your story, if they're asking for advice. And just my hope is that I can give someone the push or help or guidance that, that I got in that seminar. And also, as a kid that had this, if I can help anyone that's feeling a little bit alone or frustrated with this condition as I got, just the thought of that really just motivates me and kind of fills my cup, so to speak.
That's great. So it seems like having that community is an important part of your treatment and your disease journey. You also mentioned your wife. Can you tell us a little bit about getting support from your friends and family? And what is that like?
Absolutely. So I would say getting support from friends and family has been a big part in how I've been able to manage living with the condition. Early in my life, my family wasn't too supportive of the diagnosis, and no fault of their own. There really wasn't a lot of medical information available at the time. The first GP that, diagnosed me with psoriasis, and it wasn't psoriatic arthritis yet at the time. It was very kind of played off like, oh, it's just a skin condition. Here are some creams. And if I was having a flare or if I was, having kind of a bad day with it, it was always just something regarded with my family growing up as, well, something you have to live with, unfortunately. So I would say support is very important. And that's one thing I try to advocate for. Like I said, it wasn't until I met my wife, I really felt like I found a partner with this. And, I think I was very lucky to find someone and meet someone that knew so much about my condition. So I didn't have to explain it. She had a family member, her mother, that had psoriasis. There was already that mutual understanding. So yeah, one of the things I try to push for in the community is seek help, ask family and friends for support. I know definitely myself, that's one thing I shied away from, in my young adult life, definitely in my 20s. It was just something I didn't feel comfortable talking about with my friends. So to me, that was one thing I would change if I went back. It would be to seek help and engage in communities. One thing that really bothers me, growing up living with the condition is diagnosis where, oh, it's just this, it's something you'll have to live with. Though when I see posts like that on the online community, that really kind of gets me going. And one thing I try to advocate for is, proper treatment. And you don't have to listen to just that one diagnosis. It's your right to go get a second opinion from another medical professional if you don't agree with the advice that you're given. And that's one thing I wish I knew in my younger days was, okay, I don't like that diagnosis, but I thought I had to agree with it. You don't have to agree with it, especially now with all the information that's made available. There's a whole community out here for you. So yeah, definitely getting the support and the backing of your friends and family. If you can, that'll be an immense help.
That sounds like solid advice, and we really hope that that can help someone find their community and find people to open up to. How has your experience of having psoriasis and psoriatic arthritis changed over the years? You did mention at one point you had psoriasis plaques covering 90% of your body. I know that must have been a challenge not just physically, but emotionally as well. Do you look at this condition differently now compared to what you thought in your 20s?
Absolutely. In my 20s, I would say I thought it was just this, not horrible, but, very unpleasant thing I had to live with. And, and it affected my life in a lot of ways. Like you said, both emotionally and physically. Physically, I just remember hot days in the summer. I had huge patches on my legs and my knees. I would not want to wear shorts. So it would be 80-degree weather outside and I'll still be in jeans. Remembering my younger days, my friends would invite me up to like a cottage or on a trip where I know there would be swimming. I did not want to go. I didn't want anyone to see me with those plaques. And I thought at the time, okay, this is going to be kind of the rest of my life. And unless I get comfortable with showing my skin, and maybe I will later on in life, maybe I won't. I kind of thought that was kind of the hand I was dealt, so to speak. Now that I've had treatment, I just feel very fortunate to have a treatment that works, to be able to not have to worry about any of those kind of emotional kind of hangups I used to have about going out. And I just want to say that later on in my life, before I got started treatment, I did get to a point where I say, hey, I don't care. I'm going to wear shorts. I'm going to go out. And I just want to say to anyone feeling like that, if you're comfortable with it, it's okay. Do it. I didn't care about what anyone else said or thought of me. And if you can get to that point emotionally, that's great. If you're not, that's okay. I lived with that for a lot of time. But yeah, just how I look at it now, it's an unfortunate condition to have, but I'm very grateful that I have a treatment plan and a team of medical professionals with me that support me, family that supports me, that allow me to manage the condition and live, it's a little cliche, but, kind of my best life.
Yeah, great. You seem to be very resourceful too, and having this condition for so many years now. Do you have any other advice that you would share with someone who might be newly diagnosed that might not have access to resources or a support system?
Yeah, my advice would be first, it's okay. It's not your fault, first of all. And my first kind of advice would be, and I know getting a diagnosis like this is a shock. And I'm thinking back to when I was diagnosed with psoriatic arthritis, I kind of known that it was on the way. So I can only imagine getting a diagnosis like this out of the blue could be a shock. And I would say, if you can, and this is your kind of first journey into reaching out, looking for resources, there is an amazing online community out there full of folks like you that have this condition and are fighting the same battles right now. And some of them are a little bit further along in the battles. So my advice would be you're not alone. It might feel that way right now, but that's not the truth. And folks like myself, and I know a lot of other folks in the community, are very, very kind and loving and supportive. So, we're out there. Please reach out. Don't get discouraged. And we're here to help.
Those are some great words of encouragement. Thanks for sharing that. Now, what is something you wish you knew when you were first diagnosed about advocating for yourself as a patient?
One thing that comes to mind was this seminar that I attended. One of the best advice that I got from that seminar was to speak with not just your GP, but ask for referral to definitely a dermatologist or a rheumatologist. Looking back to when I was first diagnosed, one of the things that always surprised me was I was never passed on to that dermatologist or that rheumatologist. So to me, that would be kind of the best advice that I would pass on is if you haven't been referred to that kind of that next level, to that specialist level, and you feel like you might benefit from it, look into that. Do some research because I love my GP, but I found with GPs, though they're going to have varying levels of expertise into the condition. Again, if you're ever feeling like something's lacking, something's missing, you can definitely advocate to get referred to a specialist. So I would say that's probably the one advice that I was given in that kind of seminar that I would like to pass on.
Yeah, that's a great piece of advice. Looking back on your own journey, you realize that you weren't automatically referred to a specialist. This sounds like a good time to introduce our other guest, Dr. Ruderman, who is a specialist. Dr. Ruderman is the Associate Chief of Clinical Affairs in the Division of Rheumatology at Northwestern University's Feinberg School of Medicine. He'll be our guest in our third episode and will provide his insight as a medical professional. Dr. Ruderman, what do you think of that advice that John shared with us?
John, that's a great piece of advice, and I can't agree more. What I would say in response to that is, you know your body and you know how you feel. And if something's not right, you know that. And you're absolutely right. GPs have different levels of expertise. They have different approaches on how much they think they should be able to handle on their own versus sending you out to a specialist. And, most of the time, if you have a good relationship with your GP, that's going to work out fine. We often rely on them to tell us when we need to go to a specialist or whether it's not something that needs to get there. But if you're not doing well and they say, I don't know that you need to, be your own advocate and push for that and say, it wouldn't hurt to just get an evaluation. And let's make sure that we're doing everything we can and that there's not something else that we should be thinking about so that I feel better. I think that's very appropriate, and I think that's a great piece of advice.
You highlighted the importance of listening to our bodies and recognizing when something feels off. We trust our GPs to guide us in our healthcare journey, and a good relationship with them can often lead to successful outcomes. Your perspective aligns perfectly with the idea of taking an active role in our healthcare. I've learned a lot so far, and I'm excited to ask this next question to John. John, you seem to be full of good advice, so now let's talk about not so good advice. We hear this all the time, that people share with friends and family that they have a serious autoimmune condition, and all of a sudden, everyone's an expert. What is the craziest advice you have received from a non-expert about treating your condition?
Ooh, that is a good one. That is a good one. I love my armchair experts. I would say, have you ever tried opening a can of, I forget what fish it was. It was a canned fish. And have you ever tried just putting direct fish oil on your skin? So just going to the supermarket, opening a can of mackerel or whatever, and spreading that on your skin. I remember that I was at a party and an aunt of one of the party had done that and it cleared up her skin.
Well, this episode now needs to come with a don't try this at home warning. How would you respond to advice like that?
Yeah, so that's one of the things that has always kind of plagued me wherever I would go. You'd be at a social event and someone would come up and, you'll get remarks about, oh, what's that? What's wrong with your arm? Or what's wrong with your leg? And you get advice like that. And when I was younger, it would visibly make me annoyed. I'm not going to lie. It's not something you want to be called out about. You want to blend in with the crowd. You don't want to feel like you're special or you're different in any way. Later in life, it's one of those unfortunate things that you have to deal with. And one of the things I've learned and adopted as part of my philosophy is you don't have to listen. They can give you that advice, but you're under no obligation to take that advice seriously. You're under no obligation to try that advice. You're also under no obligation to make them feel good about giving the advice. People pleasing has been one of my things I've been trying to work on in my life. And you can be polite. You can be not polite. It's up to you. But one thing I found what works for me is you can politely excuse yourself from the conversation, but you don't have to let that advice live in kind of your brain. You can make a conscious not to listen to that advice. And to me, that's the best advice I would pass on to how to deal with that.
I really like that answer. Yeah. So hear that, everyone. You don't have to listen, and it's your choice with how you respond. All right. So as we wrap up this episode, can you share a secret that you would only tell members of the Psoriatic Arthritis Club or those who may become part of the club?
One secret or one thing I would say is you deserve kindness. You deserve space to deal and handle with the condition. And if you need to take a day off of work, if you need to not go to a friend's party or some kind of event that you feel like you have to go to because you're not feeling up to it. I had spent a lot of time in that space of, I have to go. Don't want to not be normal and whatever. But, you deserve kindness and you deserve any kind of special care and extra care that you need. So my secret is put yourself first. Do what's right for you. You know yourselves better than anyone else. So be kind to yourself. Don't be afraid to ask for help and put your needs first and pay attention to your needs. They're important.
Thank you for that. John, you have a really valuable perspective, and I hope our conversation inspires a more inclusive dialogue about living with psoriasis and psoriatic arthritis.
No problem. Thank you very much for having me.
That's it for the Psoriatic Arthritis Club. Thanks so much for listening, and we hope that John's story will inspire you along your journey. And if you haven't already, make sure to check out our first season, where we'll share more incredible stories that inspire and touch the hearts of our community. You can find all episodes on our platform. This podcast was made possible with support from AbbVie. For more information and stories from other PSA patients like you, subscribe to the Psoriatic Arthritis Club or visit psoriaticarthritisclub.org. You can also visit CreakyJoints.org for the latest information and news about living better with PSA. If you like what you've heard, be sure to rate our podcast, write a positive review, and spread the word by sharing with your friends and family. It'll help more people like you find us.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.